Hello and welcome to Chapter 16, Therapy and Treatment. The last chapter in Introduction to Psychology here, discussing what do we do when a person has troubles, has mental illness, mental disorders, and whatnot. And what we need to understand about treatment, first off, is treatment is in response to our understanding as to the etiology and potential cures for what ails us. So the history of treatment for mental illness is wrought with bizarre instances that in retrospect seem archaic, if not barbaric, but reflected the understanding of mental illness at the time. And that still remains today. We still are trying to understand at a deeper level what it is that mental illness actually is in terms of the brain, in terms of brain chemistry, in terms of the psychosocial situations that we're in. And it continues to elude our strict definition so that we could come up with a strict definition of treatment. So if we look back in the early days of treatment and mental illness, we see things like this. This is a notorious tool that was used to do the prefrontal lobotomy. And interestingly enough, I point this one out because this actual procedure represents the only Nobel Prize awarded in this field. Not the best representation of what the field of psychology has done, but at the time, it was revolutionary. That device that you see in this image is a spike that was driven into the person's skull with a hammer above the eye and was wiggled around inside the brain in order to disrupt neurological signals and brain functioning in the prefrontal cortex, primarily addressing issues of violent and uncontrolled behavior, and made famous in the movie One Flew Over the Cuckoo's Nest when Jack Nicholson's character, who had been causing a ruckus on the ward at the end. This is I guess if you've never seen it, it's sort of a deal breaker here. Spoiler alert, he gets a lobotomy. And that's how they deal with it. Prior to this time, if we thought that mental illness was the result of demons inside of us that need to get out, we would drill holes in people's heads to release the demons. If we thought it was a condition of their blood, having too much blood or the wrong kind of blood, their humors were off, we would have bloodletting and leeches. We dispose of people, we would lock them up, we would do all of these different things. And even as we became even modern and we started to look at a more moral treatment of individuals with mental illness, we see individuals locked into institutions, and then the advent of medications, which in many ways had lots of iatrogenic effects. Iatrogenic effects are the negative aspects of treatment. There might be a clinical outcome that's desirable, but the negative outcomes of that particular treatment might far outweigh the benefits. And the study of iatrogenesis is the creation of more problems with the solution. So that's a broad scope study when applied to mental health. Certainly lots of instances of that. I do want to spend a little bit of time. There's all kinds of treatments and medications and stuff like that we can go into, and different kinds of therapy and blah. But I would rather spend a little time talking about what I see as a critical difference between treatment and rehabilitation. Now, my field prior to becoming an instructor, I worked in the field of psychiatric rehabilitation. And so this distinction, although It's not necessarily reflected in orientations to the field or people within the field. I like to draw this distinction because it was important for me as a person who worked in rehabilitation to understand exactly what these terms meant. When we refer to treatment, what we're referring to are procedures, be they therapy or milieu experiences, or that's setting, different settings, or we're looking at medication, psychosurgery, electroconvulsive therapy, all the different things, specifically to reduce the occurrence of symptomology. If we look at this sort of like a broken shoulder, so you break your shoulder and you go to the hospital, and the treatment is the process by which they put your shoulder back in place, they wrap the bone, they deliver some painkillers, and they basically get the bone in place to heal. All of that is considered treatment. Now, because of the nature of that kind of injury, a person is going to have limited mobility of that particular area, and they're going to have to learn how to do things with the other hand, or to, kind of operate for a while with only one arm to do those things. And the process by which we teach somebody to return to functioning at the highest level possible, despite the injury and disability, is the process of rehabilitation. And we often hear that. I went to the hospital for an injury, and then I spent some time in rehab. Now, rehab, when it comes to a psychiatric condition or a mental illness, is the process by which we help a person return to functioning despite the presence of symptomology. I say this, despite the presence. Now, these are complementary approaches. While the individual is exploring treatments to reduce the symptomology, rehabilitation people they're in the here and now, let's say. While you're working on these things, how are we going to help a person get things done, to successfully live in the society, to do the regular things in terms of taking care of themselves, taking care of their house or apartment, or having relationships and doing work and having good times and whatnot. All of those things, helping those individuals in a way to live the best life that they can, even though that they have these symptoms. Now, it's particularly important to recognize the role of rehabilitation in mental health, because if we go back and look at the conditions of mental illness, we see that they are chronic, persistent, and pervasive. So when we look at rehabilitation, we're looking at the individuals had symptoms for a long time and they resist treatment. So we may be looking at a situation in which the symptoms are going to be present for a long time. That may not be the case for the injured shoulder. We might just need to have a temporary rehab program, and then maybe some muscle buildup and some, exercises and whatnot to return the shoulder to its normal functioning prior to the injury, and then the person's life remains unchanged. That may not be the case in an individual with chronic, persistent, pervasive mental illness. Those persistent and pervasive parts mean, okay, yes, the individual will in all likelihood have symptomology continuing for a long time, and that symptomology affects many areas of that individual's life. Again, the shoulder injury is, of course, important and whatnot. Depending on what the person does, there might be a lot of their functioning that is not impacted by that particular shoulder injury. And so rehabilitation becomes an incredibly important tool in assisting individuals in living their best lives with a mental illness. We see it in the language of rehabilitation when we refer to an individual as a person with a mental illness, and the strivings of people who work in rehabilitation are to assist that person in thriving despite the fact that they have these symptoms and this mental illness. and vital, important aspect of the entire mental health system. Now, the truth is you'll actually hear the word treatment used to describe all of that. Even when I was working in rehabilitation, we referred to the plan as a treatment plan, and the treatment was focused on rehabilitation. You might even see that within the medical community. You might see the treatment plan for the physical therapist is a rehabilitation plan. It doesn't really matter. The philosophy that I'm trying to convey here is that there's a difference between efforts where we're trying to reduce symptomology and efforts that we have for trying to live with that symptomology. So just making that distinction in terms of the kinds of services available for individuals with disorders. And it's when you look at trauma, the kinds of disorders where you might see more often in terms of anxiety and trauma and childhood abuse, anyway, historical things that have happened to an individual. I said trauma already, but that those things often the course of therapy has a rehabilitative component to it. We can't go back and change those events. We may not even be able to directly address how they have impacted you physically and whatnot, but therapy may teach individuals a way to cope or practices to engage in when those particular memories or those particular things begin to interfere with their functioning so they can maximize their life. And so even when we look at some of the treatments, they have sort of a rehabilitation feel to them. Oftentimes we might even refer to medications as taking the edge off of a particular level of symptoms so the individual will be not cured per se, but they'll be in a place where they can start to take advantage of the rehabilitation opportunities that are in front of them that will also enhance their lives. And notwithstanding, there is ample evidence that rehabilitation, the process is, let's say, someone moving toward independence to, let's say, they're able to have their own place and they start working and they start having a network of friends, that those results of living with their symptomology often have an impact on the symptomology itself and may reduce them. So there's actually a treatment effect for the rehabilitation component. And that's why this field is so interesting, because of those interactions between treatment and rehabilitation and how they affect one another in a well-balanced, well-developed mental health treatment world, which is difficult to come by. And so with that, we end our time together in terms of this Introduction to Psychology class. Please like, share these videos. They're all part of the class that I'm teaching at this point, and I've really enjoyed kind of doing the whole class, lectures based on what I would be doing in a face-to-face class. So thank you for enjoying this particular series, and I look forward to doing more videos for you. Take care.